I am Dr. Carla Garcia, owner and operator of the Thermography Center in Albuquerque, New Mexico, and DFW Thermography in Irving, Texas. We've been offering thermography to patients for over 18 years. This presentation covers the use of thermography for breast imaging. Thermography is about symmetry. When we're healthy, we emit the same amount of heat from both sides of the body. If not, then one side will be different from the other. In this temperature scale, white represents the hottest temperature in the image, while black is the coldest. Red, orange, and yellows are the warmer colors, and greens and blues are the cooler colors. It doesn't matter what the colors are as long as they're the same on both sides. If we draw a line down the center of the image, the colors, or the temperatures that the colors represent, are basically the same on both sides. Warmer areas may represent areas of inflammation. Patients frequently ask us what they should look for when comparing thermography clinics. 1. Ask if you will have to sit in a cold room or put your hands or feet in cold water. If they say yes, their camera is likely not calibrated to the human body. Many thermography cameras were designed for other applications and then modified for clinical use. Our camera is a Class 1 FDA-cleared camera designed and calibrated specifically for use in the medical field. 2. Ask if the report will be written by an MD. Our reports are written by licensed medical doctors trained in thermographic interpretation. This means they've completed 4 years of medical school, years of residency, and have a good understanding of physiology, how the body functions, and pathology, disease processes. When you show your report to your doctors, they're more likely to accept the results in your report if it's written by an MD. The most common application of thermography is as a breast imaging tool. Mammograms are a form of X-ray and depend on variations in tissue density that occur at a later time in the disease process. This is an image of normal breasts. You can see that the temperatures are very symmetrical when comparing the right side to the left side. In addition to the negative aspects of radiation exposure, many patients complain about the pain associated with a mammogram. This often results from the compression used to spread the breast tissue over the mammogram plates. The mammogram only images the tissue that is compressed between the plexiglass plates. Thermography images the entire chest area, up to the base of the neck and underneath the arms. These areas cannot be imaged with a mammogram. This is important because there's lymph tissue above the breast all the way up to the neck and in the axilla or underarms. As you can see in this mammogram image, it's very difficult to distinguish between dense breast tissue and areas of calcification that may represent cancer. Not all microcalcifications seen on a mammogram are cancerous. Dr. Susan Love, MD, is a nationally recognized breast surgeon who says that finding cancer in a mammogram of dense breast tissue is like looking for a polar bear on an ice cap. Breast density is very common. Breasts are made up of lobules that produce milk, also called glandular tissue, and ducts that carry milk from the lobes to the nipple, and fibrous tissue and fat that give breasts their shape and size. Having dense breasts is not abnormal. Some states have passed legislation requiring that mammogram reports now contain a disclaimer statement that says mammograms may not be effective when imaging breasts that have dense tissue. But more than 40% of women have dense breasts, and dense breast tissue is not entirely age-dependent. Many women past the age of 60 have dense breast tissue. Thermography results are not affected by tissue density or breast size, and it is safe for breast implants since no compression or implant membrane drying radiation is involved. These are images or views taken during a breast thermography appointment. As you can see, thermography images the entire chest area, all the way up to the base of the neck and underneath the arms. This is more than double the area that is imaged by a mammogram. Heat in a thermogram can represent lymph congestion, estrogen dominance, or neovascularity, angiogenesis. Both those terms refer to the creation of new blood vessels that accompany tumor growth. As a tumor is forming, it recruits a blood supply to feed itself, and these new blood vessels, filled with warm blood, can show up as a warmer temperature on a thermogram. In this image, the right breast has been diagnosed with inflammatory breast cancer. Inflammatory breast disease is suggestive and oftentimes it's aggressive, and oftentimes deadly because it's not detected in annual mammographic screening. By the time symptoms of heat, swelling, or pain are seen clinically, the disease has progressed significantly. With thermography, the heat associated with this type of breast cancer may be visible long before any clinical signs of disease such as skin discoloration, swelling, or pain are present. Inflammatory breast disease is aggressive and most commonly seen in younger women. This is a patient that used both mammography or x-rays and thermography to monitor her breast changes. You can see on the top baseline image that there is some suspicious heat in the upper area of the right breast. This patient was advised to return for a second appointment in 3 months. In the leftmost image, you can see that the suspicious area seen on the baseline is showing a little larger area of increased heat. The patient was sent for a mammogram, which came back negative for breast disease. There was enough change that the patient was encouraged to return for a third thermogram in another 3 months. The 6-month image shows even more heat consolidation, so the patient returned in 9 months. The subsequent 9 and 12-month images showed more and more heat. At the 12-month thermography, a second mammogram was ordered that came back as inconclusive. The referring practitioner decided to order an ultrasound-guided fine needle biopsy just to be on the safe side, and the results were positive for breast cancer. Both of these images show normal thermal patterns. The image on the left shows a patient that is overall warmer than the patient on the right, but still considered normal because of the symmetry from left to right. This is a patient that was using her bra to hold her cell phone. This image was taken 30 minutes after she removed the phone, and you can still see that the left breast, where the cell phone was sitting, is warmer than the right. This illustrates just how sensitive and well calibrated our camera is. About 1% of breast cancers occur in men. The small amount of breast tissue in men, or women with small breasts, makes it hard to perform a mammogram. Thermography is a viable option for these patients. Underwire bras do not cause cancer. There are even television commercials that tell us just that. The image on the left is of a woman who wore underwire bras every day. You can see the heat scattered throughout the chest area and concentrated in the underarms. The images on the right is 3 weeks after she stopped using an underwire bra. It is obvious that the temperatures in the entire chest area are cooler. Underwire bras restrict movement, causing lymph congestion, which increases inflammation. So, underwire bras do not cause cancer, but they do restrict movement, leading to increased heat in the breast area, and that can lead to breast cancer. From this brief presentation, you know that with thermography there's no radiation, it's painless, there's no compression, reports are written by MDs, it images under the arms and up to the base of the neck, it easily images dense breasts, and it is totally safe for implants.